Welcome, everyone. Okay, let's jump right into this. Today, we've got an absolutely crucial explainer lined up for you about dementia care. But we're not just going to rattle off clinical definitions or talk about sterile hospital corridors. Instead, we're taking a truly holistic, human-centric look at what it actually means to support someone living with this condition. Whether you're a healthcare pro, a family member, or just someone wanting to understand this really profound human experience, this explainer is built to give you clarity, structure, and above all else, empathy. So, let's get into it. 700,000. Let that number sink in for a second. That is the estimated number of people living with dementia right now in the UK. The scale of this is absolutely massive, which is exactly why it's become a huge national priority. And while it's totally true that most folks with dementia are over 65, it's super important to realize that at least 15,000 of those cases are younger people dealing with early onset dementia. It's a growing reality, and we all need to be prepared for it. Now, you probably know that dementia isn't just one single disease, right? It's really an umbrella term. Alzheimer's disease is the most common one you hear about. That accounts for about 60% of cases. But then you also have vascular dementia, which is often tied to strokes or blood flow issues, and dementia with Lewy bodies. Both of those make up around 20% each. These are progressive neurodegenerative conditions that gradually wear down mental and physical function. But as we're going to see today, the medical reality, that's really only half the story. So here is our roadmap for this explainer. 1. Defining dementia. 2. Perspectives. 2. The person-centered approach. 3. Mental capacity and choices. 4. Recognizing and preventing abuse. And 5. Practical support and technology.
Section 1. Defining dementia. 2 perspectives.
So lately, there's been this massive paradigm shift in how we look at care. Traditionally, we relied on the medical model. That's the view of dementia as a progressive brain disorder causing inevitable decline. It's very focused on the disease itself. But then we have the social model, and this is a real game changer. This perspective argues that while, yes, a person has a cognitive impairment, their actual disability often comes from the way society excludes them or from environments that just aren't adaptable. It totally challenges our preconceptions. It basically says the condition isn't the individual's fault, and we really need to focus on the capacities they still have, rather than just fixating on what they've lost. To really drive that social model home, think about this example. If it is known that a man with dementia was once a prisoner of war, it can be understood why he becomes very distressed when admitted to a locked ward. This is exactly why a person's biography matters so much. Without knowing his history, a well-meaning caregiver might just label this guy as antisocial or a problem wanderer trying to escape. But with a little empathy and context, his behavior makes complete logical sense. We literally have to look at someone's past to understand their present.
Section 2. The person-centered approach.
Taking a person-centered approach means seeing and valuing the human being first and the dementia second. It sounds like a no-brainer, right? But in practice, it's actually incredibly profound. It means you are actively promoting their identity, their dignity, their culture, and their choices, way above whatever their medical diagnosis says. You always use their preferred name. You make sure to learn their cultural needs. You aren't just managing a medical case. You are supporting a real human being with a rich, completely unique history. But we do have to remember that this journey is usually born out of trauma. When someone gets a dementia diagnosis, both they and their families go through a profound sense of loss. You can actually map this through the Kubler-Ross stages. It usually starts with denial, just pure shock and disbelief. Then comes anger, feeling like life is completely unfair. That can lead into bargaining and eventually depression as the harsh reality really sets in. Finally, there's acceptance, where the person starts to adapt. As a caregiver, recognizing these specific stages is absolutely essential if you want to provide warm, dependable support. Now, as caregivers, our natural instinct is often to just jump in and do everything to help. But consider this. If individuals are not allowed to use the abilities they have, it results in disempowerment. It is so incredibly tempting to just take over, especially when you're trying to be helpful. But doing things for someone that they can still actually do themselves, that accelerates their withdrawal. It strips away their sense of purpose. Encouraging independence, even in the absolute smallest daily tasks, is what gives someone their sense of self-worth. Section 3. Mental capacity and choices. Over in England and Wales, there's the Mental Capacity Act of 2007, and the core philosophy behind this framework is actually super empowering. It says everyone has the right to make their own decisions until it is definitively proven that they can't. Capacity isn't some blanket label you just slap on someone. It's established on a decision-by-decision basis.
To have capacity, someone basically needs to be able to understand the information, hold on to it long enough to make a choice, use that info, and then communicate their decision. And hey, that communication might just be blinking or pointing at a picture board. This act is anchored by 5 key principles you gotta know. First, always presume capacity. Second, individuals have to be fully supported in making their own choices. Third, and this is a huge one, they retain the right to make what we might view as unwise choices. Just because you think a decision is bad doesn't mean they lack the capacity to make it. Fourth, if a decision absolutely must be made for them, it has to be in their best interests. And fifth, it always has to be the least restrictive option possible to protect their basic rights and freedoms. But let's pause here and ask ourselves a genuinely tough question. What actually happens when the right to informed choice directly conflicts with self-neglect? What if someone who clearly has capacity consistently chooses not to eat or flat out refuses medical help? The tension there is immense. I mean, an individual's personal standards of hygiene or how tidy they keep their house might just be very different from yours. We can't just jump to assumptions of self-neglect without deeply, sincerely engaging with them to figure out what they truly want. Section 4. Recognizing and preventing abuse. Because folks with dementia can experience a lot of confusion and physical frailty, they are unfortunately highly vulnerable to abuse. You've got to keep your eyes peeled for subtle indicators. Physical abuse might not just be obvious marks. It could be them flinching at sudden movements or having untreated injuries. Psychological abuse leaves no physical marks at all, but might show up as extreme passivity or a sudden, intense fear of new situations. Financial abuse could be as simple as a caregiver keeping the change from a grocery run or mysterious missing possessions. And please don't overlook institutional abuse. This is when care facilities force rigid routines, give no choices for meals, or just ignore call bells simply because it's easier for the staff. The most heartbreaking reality here is that victims of abuse rarely report it themselves. They might be too afraid, too frail, or they might honestly believe that no one will listen to them because of their cognitive decline. Sometimes, tragically, they even feel like it's their own fault. And that makes you, the caregiver, the family member, the neighbor, the primary line of defense. Being vigilantly observant for these indicators isn't just a best practice, it is quite literally a life-saving necessity. Section 5. Practical support and technology. When it comes to daily living, it all really boils down to this tricky balancing act. How do we protect someone from harm without accidentally turning their own home into a prison? Obviously, we want to mitigate serious risks, like wandering off in the cold or leaving the stove on, but we absolutely cannot strip away their freedom and dignity in the process. Well, this is where assistive technologies become absolute game changers. Simple things like pressure mats by the bed can quietly alert a carer if someone gets up in the middle of the night and might fall. High temperature and gas sensors can automatically shut off utilities to prevent a disaster. Throwing simple locator devices onto keychains can prevent that intense frustration of losing things. Dosset boxes beep to remind them about medication. These aren't just fancy gadgets. They fundamentally reduce accidents, they take a massive load off stressed family caregivers, and honestly, they can delay admission to a care home, keeping people in their own familiar spaces for much longer. But hey, it's not all high-tech. Sometimes just tweaking the physical environment is the most powerful tool we have. Folks with dementia often perceive spaces differently. A heavily patterned carpet, to them, that might look like physical obstacles or even holes in the floor. A lack of color contrast between the walls and the floor can easily cause trips and falls. And constantly moving the furniture around just to freshen up the room, that can make someone feel completely lost in their own house. By just ensuring you have unpatterned carpets, distinct contrasting colors, and a stable, familiar layout, you instantly cut down on confusion and help preserve their independence. Which brings us to the end of our explainer today. As you go forward, whether you're working in a professional care setting or just supporting your own family, I want to leave you with one final, vital question to chew on. Are we just treating the dementia, or are we truly caring for the person behind it? Because when we take the time to embrace their unique history, champion their rights, and adapt our world to better support theirs, we finally shift from just managing a disease to genuinely honoring a human life. Thank you so much for joining me today. Catch you next time.